Today, Governor Mike Pence is traveling to Washington, D.C. to talk about his Medicaid expansion program called HIP 2.0. The governor drew up the plan after declining millions in Medicaid dollars from Obamacare last year. Now this afternoon, News 18 looks at what a lack of Medicaid dollars has done to Indiana hospitals. For about a month, if you've had an emergency in Greater Lafayette, you've had one fewer place to go. St. Elizabeth Central closed its emergency room September 3rd, replacing it with an urgent care center on September 29th. Hospital CEO Terry Wilson says fewer people were visiting Central's ER.
The volume had shifted, and what was becoming a larger cohort all the time at Central in that emergency department really amounts to urgent care.
Records filed with the Indiana Department of Health show visits to Central's ER had been falling since St. Elizabeth East opened in 2010. However, there were still 25,031 visits in 2013. That led us to ask if closing the ER was because the hospital wanted to save money. Wilson says that's not accurate and points to the declining volume.
Everybody in this community who pays for health care, private citizens, businesses, insurance companies, governmental agencies, wants us to be more efficient, more productive.
Indiana isn't the only state being forced to do more with less. 23 other states rejected expanded Medicaid. Now hospitals in these states get the bad parts of Obamacare without the good. In Indiana, it would have meant 216,000 more patients can pay their medical bills. Hospitals in these 26 states don't have that problem. Their states expanded Medicaid, and as a result, they're making millions more.
I do think it is not just perhaps unfair, but really just unwise.
Brian Tabor is the Vice President of Government Relations for the Indiana Hospital Association.
In some states, you have hospitals that are seeing their payments reduced, but they're not seeing the expanded coverage that they expected.
A 2014 analysis by PricewaterhouseCoopers also says Indiana is missing out. One thing is clear, the study says. Newly released earnings and patient volume data reveal a distinct financial split between healthcare providers in states that have expanded Medicaid programs and those that have not.
I think about it as lost opportunity. What could we do with those things? Which programs could we have expanded?
States that have expanded Medicaid are saving millions in what hospitals call uncompensated care. That's the services they provide to people who can't pay for them. At St. Elizabeth East and Central since 2010, records show uncompensated care totals $124,813,137. That is all money the hospital says could be used to better serve the community and create new jobs. The saving grace for hospitals could be HIP 2.0, the governor's version of expanded Medicaid. The federal government is reviewing his proposal, but there is no guarantee the Department of Health and Human Services will approve it.
Whether it's called HIP 2.0 or modified Medicaid expansion, I don't know. I look at that as a spectrum of options, and we're going to end up somewhere in the middle, I think.
Today's meeting with Health and Human Services Secretary Sylvia Burwell comes after a meeting with President Obama on Friday in Evansville. Pence's office called that meeting brief, candid, and substantive. Well,